For you as a dental hygienist, it's really critically important that you keep up with the science and keep up with your practice. Think about what you learned in dental hygiene school, whether it was a year ago, 5 years ago, or several decades ago. Chances are things have changed, and one of the challenges that we have is keeping up with that change. However, there's a problem. It's been well documented that there's a 17-year lag in all of healthcare from when science shows a treatment is effective to when it's actually utilized in practice. And if we're not keeping up with the science, then we're not providing the best care to our patients and they're not having the best outcome. So our first challenge is to decrease that time so that we are more efficiently and effectively using science in our practice. But then that leads us to our second problem. There's so much science out there. There's an exponential growth both in the number of journals and the number of studies that are published every year. And no longer can we say we'll just subscribe to 1 or 2 journals, read them every month, and then we'll know what's going on. We need to develop a new strategy to get that just-in-time information that's relevant to the patient you have in the chair today or next week and relevant to his or her treatment or questions. So I've been involved in evidence-based healthcare for over a decade, and I've heard people say, well, evidence-based healthcare is all about the science. And I'm here to tell you that they're wrong. Yes, science is part of the picture, but there's 2 other critically important parts. And the first of those is you. It's your expertise and your knowledge. And second, it's your patient. They have individual treatment needs and preferences. And by incorporating the science, your expertise, and what your patient needs, you can help determine the best course of treatment and provide a very individualized, evidence-based, science-based decision-making and treatment for the patient. So in my presentation, I hope you'll learn the introduction and a little bit of information about evidence-based healthcare. But more importantly, I hope you walk away with some definitive and simple strategies to help you identify the science and use it in practice. This will hopefully make you a better clinician, make you enjoy your job a little bit better, and have more certainty in some of the treatment recommendations that you make. And it'll help your patient become more engaged and have better outcomes.